Hello everyone, welcome to another episode of TooHealthTalk, a show where we talk about real health challenges and get to break it down in a very real and honest conversation. On today's episode, we have a special guest. I don't think he's a guest yeah, because he's been here before. So, one of our own, Dr. Abdulrahman. Welcome, Doctor.
Thank you for having me. Happy to be here.
Yeah, same here. Happy to see you here again.
Thanks.
On today's episode, we're talking about a very underlying diseases, Sjögren. So, like, when I had of this, I was like, oh, Sjögren system syndromes, it's an it's kind of a disease that don't get to, like, show, it just gets to happen. And, so, like, I don't know, how does this disease get common, but
Okay. So Sjögren disease, also sometimes it's also called Sjögren autoimmune disease, spelled as Sjögren. Sjögren was pronounced as Sjögren. Is basically an autoimmune disease that affects the moisture parts of the human body. So it's your immune system attacking specifically the moisture parts of the human body. This includes the tears around your eyes, the tear ducts around your eyes, especially the mouth, because it's a moist region. So those are mainly the locations where it attacks. And as you can guess, the symptoms, one of the hallmark symptoms is dryness of the eyes and also dryness of the mouth. And it can also cause extreme joint pain because you need lubrication for specific joints, the hands, the elbows, and the knees. So it can cause stiffness in those body parts. So one of the hallmarks is um, dryness, extreme pain, dryness of the eyes, dryness of the mouth, and sometimes the patients can also have a brain fog. So those are the major symptoms characterized with Sjögren autoimmune disease.
so how long does it take for someone to get a proper diagnosis?
Well, for places like Nigeria, where you have an extremely limited amount of rheumatologists, a rheumatologist is a doctor who deals with autoimmune diseases, who specializes in autoimmune diseases. In Nigeria, I'm not sure if we have up to 200 rheumatologists, active rheumatologists. So what basically it's, let's say 200. So we have, I'm very sure it's lower than 200. So we have 200 rheumatologists treating a population of over 250
Yeah.
million Nigerians,
Yeah.
which is crazy. The numbers are foolish. So for you to have an appointment to even see a specialist who will properly diagnose whether you have Sjögren or not, it might take anything from uh, 1 month to 6 months just to see the doctor. Now, seeing a doctor is not the solution. You have to see the doctor, book another appointment, have some tests run. So it can take anything from conservatively 3 years to as long as 6 years, unfortunately, because of the limited number of doctors
So,
specialists.
so can this disease like lead to more damages?
Yes. So the first thing is, at what particular point was there any medical intervention for the disease? Because if, for example, the disease can cause a lot of kidney related issues, kidney damage also, and it can cause blurry vision. It can cause a lot of problems with the buccal cavity with the mouth because of the dryness, and it can also be differentially diagnosed or mistakenly diagnosed as osteoarthritis
Oh.
because the manifestations are very similar. So yeah.
So can childbirth or pregnancy like trigger children?
So for Sjögren, yes, childbirth and pregnancy can trigger it, especially pregnancy, because pregnancy is a hypermetabolic rate. It's pregnancy shifts the baseline of hormones within women. So this change in baseline can significantly change how the immune system works, especially for women, of course. And in some and in some cases you have the most of the diagnoses, 9 out of 10 diagnoses are women for the Sjögren disease.
Wow.
So it's very unfortunate that it's just gender sided.
Wow.
So yeah, pregnancy and childbirth can.
So what about stress? Can stress also trigger this Sjögren?
Stress triggers a lot of things, including and especially Sjögren. But there are many risk factors involved because if you say stress triggers Sjögren, that's a very isolated sentence. Because at the behind that sentence or behind that sentence or around that sentence, you maybe the patient has risk factors which include hormonal imbalance or genetic factors. So yes, that's
So what about can like processed food cause Sjögren?
I do. Processed food cannot cause Sjögren, but processed food can exacerbate the symptoms of Sjögren because most of the food we eat is either too sugary, too salty, or extremely processed, never natural. So so it can make things go from bad to worse, but it does not make things go bad. But generally speaking, processed food never good.
So now you talked about it being a gender-based issue.
Correct.
Yeah. So now is will an undiagnosed like Sjögren cause infertility?
As far as the study shows so far, it can cause difficulty in pregnancy because the reproductive system, like I said before, has a moist environment, right? So that moist environment creates that moist place or most moist area creates a good environment for pregnancy to occur. So when there's an imbalance, where there's a problem in the environment, it's very difficult for the pregnancy to be successful in a way.
So can this disease coexist with arthritis?
It can coexist with arthritis, yes, in two different yeah, yes, definitely can, because arthritis is basically the wear and tear, eventual wear and tear. Generally speaking, arthritis is the wear and tear of the joints, especially the big joints, while Sjögren is an autoimmune disease, so they can very much occur within the same patient. I hope it doesn't happen to anyone, but it's a possibility.
Yeah, true. So if someone has Sjögren now, do you think that people get to mistake it for other diseases?
Significantly, yes, yes,
Like what disease?
so they can easily be mistaken for rheumatoid arthritis, osteoarthritis, maybe systemic lupus erythematosus, also known as SLE or lupus. So yes, it's easily mistaken because so what and it being misdiagnosed is not because the doctor does not know what he or she is doing. It's just because, for example, medical schools in Nigeria teach malaria diagnosis very differently from medical schools in Australia because malaria is very big in Nigeria. Malaria is not so big in Australia, right? And the reverse is also applicable. Family Mediterranean fever is not common in Nigeria. Family Mediterranean fever is common in Turkey, for example. So not because they don't know, just because of the environment they happen to be in.
So can you give like three advice to women about autoimmune diseases?
Find out the symptoms, understand your body first, really understand your body, know the symptoms know the symptoms of the Sjögren disease, and if you're experiencing dry mouth, dry tears, understand that this is not normal, and don't accept just because someone tells you, even a medical professional tells you that it might be stress. Understand yourself. You know your body more than anyone else, right? And take it easy on the processed food. It's never a positive. So those are my three.
So for the treatment plan, what is it like to treat Sjögren?
Unfortunately, as of 2025, there's no definitive treatment. It's just manageable. We just manage it, just like we have diseases where you just manage the treatment, like hypertension and diabetes.
Yeah.
So we just manage the symptoms.
So how can we manage this?
Yes, of course. So you have tear substitutes, saliva substitutes, and pain management. You can have maybe physiotherapy if you have a lot of knee pain and joint pain. And that's for now. That's what we have.
And so for general advice, lastly, like what's the general advice about autoimmune disease and Sjögren?
The earlier the better. The earlier the better. Find the moment you start feeling the symptoms, don't let it go to complications. In the beginning, I'm not saying Google everything. Have a community where you can ask questions and get answered reliably, and question every answer, of course. Different people, different manifestations. Have a community, understand your body very well, and the mo- the moment you feel anything out of the ordinary, don't wait for it to become complicated. Because as doctors, if a patient comes with complications, we have no choice but to start treating them backwards. And that takes time, energy, much more money than needed. And it's a very ugly picture. So I think so those are my recommendations.
Thank you so much, Doctor, for coming on the show. If you've watched on up to this end, thank you so much for watching, and I appreciate every one of you that have watched up to this moment. For you to support what we're doing, I appreciate you like, share, and subscribe to our channel. Thank you so much for coming, Doctor.
Anytime.
See you on the next episode. Bye.